Hey guys, welcome back to the show. Today's a different kind of topic. We're talking about a plant medicine. We're talking about Kambo. So I don't know if this is on your radar a lot at all, but this is a really, really interesting topic. And my guest, Caitlin Thompson, super interesting person who has done a lot of work in this area and actually runs practitioner training programs. So in this episode of the Biohacking Superhuman Performance podcast, we're joined by Caitlin Thompson as she shares her personal transition to Kambo practitioner, revealing a profound chapter in her life where the battle with chronic illness steered her toward the unexpected healing powers of this traditional ritual. Her tale is one of resilience, bridging the gap between rigorous scientific analysis and the depths of spiritual practice. Caitlin helps us to understand the nuances of a Kambo ceremony, from its rigorous participant screening to its diverse after effects. With a neurobiologist's precision and a healer's intuition, she illustrates the importance of respecting the body's response to the frog secretion and the profound emotional release it can catalyze. Her insights into the symbiotic relationship between Kambo, Ayahuasca, and other plant medicines reveal a broader, integrative approach to emotional healing and chronic conditions. Finally, Caitlin sheds light on the exciting research surrounding Kambo's potential in mental health and chronic pain management. Now, Caitlin's background is pretty interesting. Her background's in neurobiology with an emphasis in mood disorders and autoimmune conditions. In pursuit of her own health, Caitlin has studied nutritional neuroscience and helps people conquer their chronic health struggles, autoimmune and psychiatric conditions through diet, nutraceuticals, and other healing modalities, such as Kambo. Caitlin is also an independent scientific researcher and is currently conducting the first human Kambo research in the field. Her past research has focused on psychedelic treatments for autoimmune conditions. Now, if you want to learn more about what Caitlin does, and if maybe you might be interested in becoming or adding Kambo to your toolkit as a practitioner, check out kambospecialist.com. Now, Kambo is with a K, K-M-B like Bob, O-S, specialist.com. Or you can go to medicinefrogkambo.com, where you're going to find a lot of the research that she's published, and then kambofinder.com to help you find a practitioner. Now, like I mentioned, Caitlin does offer practitioner training courses. So if you mention this podcast, you will save $100 off the final cost of your training. Now let's jump into the episode. Hey folks, just a quick reminder that all of the information presented in this podcast is for information purposes only. No medical advice, no diagnosing, no treatments suggested here. Before you try anything that you hear about or learn about here, make sure that you check with your medical provider. Hey folks, we're back for another amazing show. And today we have Caitlin Thompson with us. Caitlin is, I don't know, I'm going to call you the Kambo queen for lack of a better term right now, but you're going to clarify that. So welcome to the show, Caitlin.
Thank you so much for having me. I'm really excited for this conversation with you.
Yeah. Well, me too. I mean, I've been curious about Kambo since I first heard about it. And I think that it's one of those modalities, I guess I'll call it a modality for now. It's one of those modalities that it elicits a lot of questions, a lot of confusion. And yet the people who've gone there and for who it's worked, people like you, for example, have nothing but great things to say about it and incredible experiences. And so I'm really looking forward to this conversation and kind of diving into what do we know, what don't we know, So why don't we start with, how did you find Kambo, or how did Kambo find you? Like what led you to this place where this discipline has really become so central to your being?
Yeah, it's never would I have imagined that my life would look like this and be so focused around such a bizarre ritual and thing in general. So I first learned about Kambo in 2011 in the jungle in Iquitos. I was at an ayahuasca retreat and I heard about it, and nothing about it ever struck me as something I would ever want to consider doing. It sounded like some crazy, stupid, dangerous thing that just the natives did. So I just kind of dismissed it. But then a few years later, probably like 5 or 6 years later, a friend of mine that I knew from an ayahuasca community he had told me about his Kambo experiences. And actually, he's now a very successful practitioner as well. So we kind of got into this together at the same time. So anyways, he was the first person who ever kind of described any of the benefits to it. And I was like, oh, I was really intrigued. So he took me with him the next time that he went to a ceremony. And I really had no expectations, but it was a time in my life where I was very exploratory, especially with psychedelics. And I was young. I was, in my like early mid 20s. So I'm just saying yes to everything at that point. And right at this time, I was starting to have some light shed on a chronic health condition that I had really had my whole life. But I didn't really know how sick I was, because when you're born sick, you don't have a lot of contrast to really know that things could be different. And I always felt that there was something that was not right. And I was always comparing myself to other people. And I'm like, why do I have to sleep 12, 13 hours and my friends at the sleepover are sleeping 8 or 9, and things like that, where I just knew there was something going on. So it was really at this point in my life where Kambo came into the picture. And Kambo, in a lot of ways, helps me accidentally get better. And of course, there was a spiritual component and a psycho-emotional and somatic elements to my healing. But the Kambo started to create that contrast between feeling more vibrant and my baseline of what I was used to. And it was in that process that I started to realize how sick I had been for a long time. And that led me to eventually discovering that I had things like Lyme disease and other chronic infections, and small intestinal bacterial overgrowth and food allergies and all sorts of things that I could have collected as labels like ankylosing spondylitis or fibromyalgia, eczema, CPTSD, things like that. But at the end of the day, I would describe it as just a very unbalanced person who had a lot of immune dysfunction and autoimmunity and chronic inflammation and dysbiosis in general. So it was never really like my plan to become a practitioner. It wasn't something I sought out, but the medicine was so personally transformative for me, and I was self-administering. And then my roommate or my good friend would ask me, well, can you do it for me too? And I'm like, yeah, I guess. And then suddenly I had strangers asking me and paying me. And next thing I knew, I was acting as a practitioner, but I had no real training. So then I eventually did my actual certification training. And it just exploded after that, the demand for it. And it never really slowed down. So that's kind of how I arrived in the position of a practitioner. Like, as corny as it sounds, the frog really did choose me and kind of decide that that's what I was going to do, and created opportunities for that to happen that were just laid out like a red carpet.
Nice. Wow, that's quite a story. So you mentioned before we started recording that your background is in neurobiology. So can you talk about that a little bit? Because I'm sure that creates a bit of a backdrop or a foundation from which once you started learning about the Kambo and learning about, in as much as you can learn, because there's some research about it, but there's not a ton, in the sense that, the people who are funding research are pharma companies. And if they can't, I don't know, like right now, I guess maybe there's too much stigma around it. There's just not as much activity there as we would probably like. But talk a little bit about your neurobiology background and how that may have kind of influenced how you approach Kambo and where you've gone with it.
Yeah, absolutely. So I'm a science nerd, but I'm also a very spiritual person. And so sometimes people make the assumption that because I'm a scientist that I might be like overly reductionist and whatnot. But for me personally, even like in my undergrad studying science, I felt like I was studying the mechanisms of God and divinity in a non-religious sense. And so my frame of how I view, the pharmacology of psychedelics and the peptides in Kambo are very much just a lens that I view more spiritual matters. But it's also important that we understand things on a molecular level, not only for safety, but also just to really appreciate the artistry of these things in our bodies, right?
Yeah.
And you're absolutely right. There is really not a lot of research at all. So there's a handful of studies on the individual peptides that have been identified in Kambo, but there's almost no human research, even with the individual peptides, and there's pretty much no research with the peptides in combination from the crude substance. I think right now I'm conducting the first prospective human study on Kambo. Wow. As it's taken, transdermally by the ritualistic burning methods. But prior to that, it was like really in the 80s and 90s that Vittorio Ersprimer was the guy who did the initial identification of the peptides and mostly used them in animal models like guinea pig, dogs, rats, things like that, or even like in vitro. So we're still in like very immature days of Kambo science. And like you said, there's like tremendous amounts of anecdotal evidence that it's beneficial as a whole process, but then pretty much no research to substantiate any of this in data. So that's what I'm in the process of doing right now. And I've also recently partnered with UCSD to do more sophisticated and supported research. But I'm hoping that, we'll be wrapping up with the data collection by the end of this year for this study, and then hopefully publishing sometime in 2024.
Wow, that's amazing. That's really exciting. I'm looking forward to seeing that. So let's talk a little bit about let's start with, what does a ceremony look like? So it's definitely, there's ceremony and ritual to this administration of Kambo, which is essentially, it's if we had to define it, we'd say it's kind of like a poison because it has to be taken in tiny doses and the body seemingly rejects it, right? The physiological response is that one of purging. So maybe take us through, if you're willing to, take us through what a ritualistic administration of Kambo is, and then I'd love to dive into a little bit, what are some of the benefits that you've observed clinically, because you've now administered this like hundreds of times, if not thousands. So here we go. We're diving in, guys.
So this might burst some people's bubble, but the truth is, in the jungle, in the traditional indigenous ways of using this medicine, there is no ceremony. There's no songs. There's no spirituality. There's no ritual. There's no anything. It's just a part of their daily lives. And different tribes will use it in different frequencies and in different ways. But that is a common misconception. And I think a lot of people like to lump Kambo into ayahuasca, which has like a really, really rich shamanic element to it. But there is no shamanism at all in the use of Kambo traditionally in the jungle. So the element of ritual and ceremony is a Western adaptation, which I actually think is wonderful. And I think it provides a lot of value in a container where we can have a more psycho-spiritual experience with it. Because, the tribes like the Matses, the Yawanawa, etc., they don't really need that because their daily lives are spiritual. They're connected with the forest on a deep level. Whereas in the West, we're like so deeply craving the reconnection to our own spirituality. So that is something that is primarily, something that the gringos do, which is fine and wonderful. Now, as far as what does a ceremony look like? Well, there is so much variation in how a practitioner may choose to like express the medicine in their
Right.
particular offering. So the way that I like to serve, of course, I always do like a consultation with people. I screen them, which is very important. And I sit down with them and really talk to them about like, why are they there? And for me, I'm very adamant about using the potency of our own consciousness to really accelerate change and intentional healing. And then these medicines are just rocket fuel underneath that.
Mm-hmm.
So I'll open with a ceremonial prayer and intention setting. And then I'll usually start them with hape, which is a tobacco snuff, and something called sananga, which is our botanical eye drops that actually come from a plant that's in the same family as the iboga plant. So there's allegedly trace amounts of iboga alkaloids, such as ibogaine, things like that. And I use these things prior because they really help ease people into like more of a parasympathetic, relaxed state, and also it helps them build some skills in navigating through the Kambo more gracefully. And then once we get through those, then I apply the secretion from the frog. And this is where there's some variation as well. So if it's a first timer, I always do something called a safety point, where I add just 1 point of the medicine and observe them for about 4 minutes in order to gauge what dosage is going to be appropriate. Because especially with the population that I work with, I have a lot of people who are quite sensitive because they have like Lyme disease or autoimmune conditions. But in general, I find that we don't need to use a lot of medicine. Small doses is really a lost art that we should probably reconnect to. Anyways, and then throughout the ceremony, I'm singing, I'm rattling, I'm using sage, other instruments, providing words or affirmations or encouragement when needed. But every ceremony is unique and different. But typically the effects of the Kambo are lasting 20 to 30 minutes. And it's, there's vomiting, sometimes sweating. Sometimes people can get face swelling or need to use the bathroom. Or there can be emotional releases, shaking. It can look really different depending on the person's physiology and also the physiology of that unique frog that secretion came from, because they have individuality just like we do. They're not producing the same peptides as their frog friend next door. So there's so much variation. And part of the beauty of Kambo is it's like impossible to standardize, which is part of why it hasn't been completely exploited by pharmaceutical industry. It's just incredibly complex, and you really can't isolate one thing and turn it into a drug, because it's the magic of the mixture of the peptides and also the essence of the frog, I think, comes through and plays a role.
Yeah, that's really interesting. So to take a step back, just for people who know nothing about what we're talking about here, the way that Kambo is administered is the practitioner will basically create 1 to 5 being pretty heavy-handed, but let's say 1 to 5 tiny little burns. Usually, sometimes on the arm. I've seen them on the nape of the neck. I've seen them on the ankle, like different places. And then the blister is scraped away, and then the compound, the Kambo, is administered to that either 1, 2, 3, or however many dots. I think 1 to 3 is more standard. And the effects, and this is where we see, we talk about this even with the peptides that I talk about. The effect of peptides is so shockingly fast. Like you administer it transdermally in this case, or like to a wound, I guess a small wound, or even by subcutaneous injection, and the response is sometimes almost immediate.
Yeah.
In the case of Kambo, I think it is quite fast. Like that chemical messaging thing that happens is very fast, and that will drive, as you said, like, there's the purging, which people talk about a lot. And then the emotional thing. And so once that can last, as you said, 20 to 30 minutes, And then once that's over, and do you find that, is it a one day thing? Like sorry, I can't speak today, guys. I apologize. I have found, like, I've been in the Dominican Republic, and there's a practitioner there, and he believes in 3 days, really fairly, if not, consecutively, maybe on alternate days, depending on the individual and, to your point, how they respond. Do you have that kind of practice? Does it really just depend on the person and how they respond? Do you find there's a magic number that seems to serve people more, or what are your thoughts on that?
Yeah, I definitely encourage people to consider doing a series of 3 within a fairly close proximity. So some people will opt to do 3 days in a row. Some people will space them out a week or a month apart. It really depends on the person and their goals. Something that's interesting that we're finding from the preliminary results of our study, because we are looking at the amount of time between the first session and the third session. Mm-hmm. And what we found, which is a bit shocking, but is in alignment with what I've always intuitively kind of preached, which is that the more space that people have in between their ceremonies, this is assuming they're happening in a 30-day period, the better outcomes that they're seeing in reduction of depression symptoms, mindfulness scores, emotional wellness, and life satisfaction. Whereas the people who are doing the sessions in closer proximity, mm-hmm. they're having worse outcomes on the scores, and they're also having higher scores of the challenging experience questionnaire, because we're looking at, whether if a more challenging experience yields better results, et cetera. Right. And it seems to be the opposite, where the people that are having a more challenging experience are getting less good results on the changes in the scales. Now, that could be, it's not necessarily causation, right? It could be that people that are having more challenges in life might find the challengingness of the experience to be higher. But it is significantly linked that we're seeing that the number of days in between the sessions is correlated with how challenging the experience is perceived to be. So ideally, I like to space it out a little bit and give people time to recover physiologically from the detox and the die-off and all the just chemical and epigenetic changes that are likely occurring that we don't even know what they are mm-hmm. at this point. And also time for integration. I think sometimes we get bought into this idea in our Western culture that if we're not suffering, if it's not intense and radical and, crazy and strong, then it won't be enough, or we won't deserve our healing. And I've just seen that not to be true. And I work with the medicine in a very yin way, where I'm more concerned about using the container and the substance itself to teach the person how to train their nervous system to feel safe again. Because it seems like everything always stems back to a nervous system and trauma, right? We get stuck in these chronic stress responses because of childhood trauma or some other traumatic thing. And then we develop autoimmune disease or mitochondrial issues or whatever. And so when I kind of trace it all back, I found that targeting the nervous system and the psycho-emotional piece of illness is usually the most targeted way to address all the downstream physiological processes that have gone awry due to really nervous system mediated dysfunction, if that makes sense.
Yeah, no, that's a very interesting point. So it really speaks to the nervous system being, and it's interesting, like speaking to the nervous system being, I don't know if it's being the driver, but being the underpinning feature of so many of these diseases that we're trying to address with drugs and physiological means. And you get these people who are doing everything on paper and they're just not getting better. And nobody wants to say to them, and we're not saying it's all in your head, and yet it kind of is all in your head, not in that negative sense. It's all in your head in that if you don't address that underlying, like you say, this underlying emotional piece and stuckedness that people end up in, the body can't move. Like the body can't shift. And
absolutely.
That might be even the immune system, right? Like, I mean, look, in mainstream knowledge now, people are starting to get their heads around, if I'm chronically stressed, my immune system is going to be depressed.
Yeah, absolutely. The analogy that I like to use, because especially when I'm talking about chronic illnesses, is very pertinent. It's as if, say that the extended trauma that one experiences, maybe it's from moving a lot as a child, or maybe it's just from having an emotionally unavailable parent. Like, it doesn't have to be that someone beat you or anything like that. It can be these micro traumas, right? But say that you're traumatized as a child and whatnot. And sorry, I have a little brain fog for a second. What was I talking about again?
With having trauma.
Oh, yeah. The analogy. Thank you. Sorry. Also spaced out. So the analogy I use is, say that trauma is someone's turned on the sink in the bathroom and it's running. Eventually the sink is going to overflow and spill water everywhere. Now, over time, that's going to cause water damage. It's going to rot your floors. It's going to mess up your pipes. There's all this real tangible damage that's going to happen. So that is the physiological stuff, like the autoimmune mechanisms and the infections and the inflammation. That's all, like, the bathroom has been destroyed. So in order to fix it, yes, you have to clean up the bathroom and get the towels and dry everything up and maybe replace some things. That's like the diet and the supplements and, this and that, or all these interventions that we can do to nourish our body. But if you don't turn off the faucet, then you're going to be doing all this stuff to try to help your body, but your nervous system is perpetuating the pattern of maladaptive function. Yeah. And so you really do have to simultaneously nourish and correct the dysfunction in the physiology, while also addressing the state of the nervous system and the deeper psychological pieces that perpetuate the nervous system state. So it's very complex. And one of the things I love and admire about Kambo is that it really does address both of those things simultaneously, especially in the context of a ritualistic container.
Yeah, no, I love that. I think it's just so interesting. So you've so interestingly enough, you've delved into ayahuasca and other psychedelics, and yet you picked Kambo, or Kambo picked you, however you want, Kambo chose you, but really you chose Kambo as your principle. I don't know if you do if you practice the others with patients or clients as well, but you chose Kambo. Why did you choose Kambo over the others, do you think?
Yeah, I'm definitely a psychedelic enthusiast, and trust me, I've had a lot of experiences with those medicines over, a decade and a half. But with Kambo, I find that it's more effective for a lot of the things that I'm passionate with helping people with. Yeah. And sometimes with my clients, they go, "Oh, I'm thinking about either doing ayahuasca or Kambo for my fibromyalgia or my chronic fatigue or whatever." And I'm like, hands down, the Kambo is going to deliver more bang for your buck. And it doesn't mean that I don't think psychedelics are useful tools. I've published papers on psychedelics as novel approaches to autoimmune conditions. So I do believe that they have a place as well. But I just find the Kambo to be a more appropriate tool for those types of chronic inflammatory conditions. And it's also more accessible for people. It takes less time. It's less expensive. It's not psychedelic. So people aren't afraid of it in the same ways as they are something like ayahuasca. So I don't know, it just felt more resonating with me and what I would like to offer.
Yeah. Well, and does ayahuasca reset the immune system? Because one of the things I've heard talked about around Kambo is there seems to be some degree of immune system reset that takes place I don't know if it's for everybody, but certainly for some people. And it would speak to the population of people that you're seeing being helped by this, including yourself, like people with Lyme and chronic infections and autoimmune disease. Is it, my impression and is that ayahuasca might be more up in the head kind of thing. And Kambo is up in the head, but also physiologically, that peptide cocktail, whatever it is, it's epigenetically, as you mentioned earlier, it's flipping genes on and off. It's actually resetting certain systems in the body.
I'm sure that on a physiological level, ayahuasca is also doing things like this.
Okay.
And I know there are immune modulating properties to things like DMT and the sigma 1 receptor, and also the downstream effects of all the neurotransmitters. They're very immune modulating. However, just from a generalized description of the experience, I find ayahuasca can kind of take people up here, above their head and pull them out of their bodies, which sometimes is beneficial, but I feel a lot of times people are already so detached from their bodies. And with Kambo, I find it kind of pulls you more down towards the earth, and into the somatic experience of reconnecting with your body. And I think that is critically important for people that have disassociated and become disembodied from trauma, or just from a lack of mindful awareness of their physical being. And there's really no way of cheating your way out of it with Kambo. I see people really try to disassociate with it and they struggle. They're just like in battle with it. And I'll be like, hey dude, as soon as you just let go, you're not going to suffer. So the only way through Kambo is to allow, and it's counterintuitive, because sometimes you want to just like brace yourself and blast your way through, which is a stress response pattern, right? Of just bracing yourself and smashing through the wall with your head. But Kambo teaches us that the only way through is to open and to not be contracted and to just allow. And as soon as we do that, our suffering completely stops. So it's the greatest teacher in that way.
Yeah. So it speaks to surrender, really.
Absolutely.
You have to surrender to the experience. So I wanted to go back to what you were talking about earlier, which actually was really interesting. I don't know why I went off on another tangent, but when you were speaking about spacing the treatments or the administration of Kambo and seeing better results. Like, that's a really interesting idea, right? Because it speaks to allowing both the body and the mind, and you said it as well, to integrate the experience and to maybe go through a process and allow for a certain amount of healing and recovery before you kind of go at it again. And so is that changing the way that you're offering Kambo to people? Are you really kind of trying to discourage people from doing the 1, 2, 3 kind of, really fast successive treatments? Or is it still kind of up in the air, or it might be different for different? I mean, I'm sure it's different for different people, but it sure sounds like your research is pointing in a very specific direction here.
Yeah, I mean, luckily, I already was in a place where I was encouraging people to have more space in between. So it hasn't necessarily changed how I practice or how I advise people, but now I have some data to actually support that opinion. So it's not just my subjective, take on things. Now I can be like, no, there's objective, numbers that show that you're probably going to get more out of this if you space it. Doesn't mean I won't do 3 days in a row. If somebody wants that, and requests that, or maybe they're from out of town and that's what's most practical. I don't think it's bad to do that necessarily. I just think it's not ideal.
Yeah, no, that makes sense. Okay, so we talked a bit about autoimmune Lyme, and so, well, actually, let's go back to that a little bit. So you've definitely found it to be helpful with those conditions, but how much are you coaching people as well through, like, I can't imagine you just do Kambo and you wake up the next day and you're all better. But maybe you are. I mean, definitely you speak to it as having lifted the veil from, you would, and we see this all the time. People normalize feeling crappy. People normalize we adapt to survive, right? So we think that you're supposed to be tired all the time or be bloated all the time. Like we kind of get used to it, and that's just the way we are. How fast did you see that shift happen for yourself, or how fast do you see that physiological shift happen for your clients? And how long does it stick? And do you have to then start applying other more conventional therapies, like whether it's supplements or probiotics or certain medications in certain cases? What are you seeing there?
Yeah, the sad thing is, I don't get to really know where people are on in their journeys long term just through my practice, because it's like I do follow up with them, and then hear sort of the acute effects from them, but there's so many just coming through, and I have no idea what they're doing a year later. And that's why the study's also good, because we do a 3-month long follow-up, so we can see where they're at on that 3 months. But yeah, unfortunately, I have a very limited scope. Now, sometimes they will work with me doing additional consultation with, diet, nutrition, and other interventions and modalities. And I can kind of help them with a more multifaceted approach to healing from their chronic illness. And of course, I do offer opinions and advice on, maybe try this thing and this thing and this thing. And at the end of the day, it's important to acknowledge that there's no such thing as a silver bullet. You need about 15 silver bullets, and you really, with chronic illness, you really have to find like the perfect storm of highly effective things that work for that individual. And it's going to be different for each person. And that's part of the fun, is that you get to figure out the unique puzzle that is you. So in a way, having a chronic illness is a very intimate process of knowing yourself on a deep level by exploring with all these modalities and such. But yeah, people do have dramatic results immediately after the Kambo. And what I have noticed is that people, the interventions that they are doing already, but maybe weren't working or getting anywhere with, they'll start having more momentum and spaciousness in like an upward spiral. It's kind of like the Kambo like unclogs the toilet, or maybe like detoxification pathways, and really like modulates processes that are natural to the body to do things like shuttle out heavy metals, or boost a more robust immune response, and then deal with pathogens that are overgrown, etc. So people do start to get more momentum with the other things that they're doing. But, for myself and for a lot of other people with chronic illness, having regular relationship with Kambo is really the best way to get substantial results that are permanent. I had to use a lot of Kambo to get to a place now where I use it pretty much almost never. I really only use it when I'm in the jungle with the Matses twice a year leading groups. So at that point, it's more of just a pilgrimage than a medical need. And I do use microdoses to manage infections and stuff sometimes. But as far as like needing to go through the ordeal of a full purgative experience, I'm not in a place where I need it anymore. But it took several years of regular, consistent application, but it was really, there was a difference even between the first, second, third, and fourth session. The first session that I did, it took me about a week of feeling like crap with like Herx effects and, being lethargic and achy and very sensitive. And then the second time, it took me about 4 days. And then the third time, it was like 2 days. And then the fourth time, I jumped up the next day, had tons of energy, and ran up a mountain. Wow. And so there was like a very noticeable decrease in the recovery time. And my sessions were spaced like a month apart. So that wasn't even an aggressive treatment at all. And then I did regular maintenance about once a month for the first year or so. And then I started feeling like I could go 6 to 8 weeks in between sessions. And then I started feeling quarterly, like every 3 months. And then maybe every 6 months. And then I like looked back and I was like, wow, I haven't had a full purgative session in a year. I've just been microdosing to battle all these weird infections that you get living in Indonesia.
Yeah.
So you do arrive at a place, hopefully, where you don't have to like keep doing all these crazy dramatic interventions, and you can just enjoy your health, and your baseline is going to be much higher.
Yeah, that's so interesting. And I do think another piece that you spoke about earlier that must come into play is the whole brain piece, right? The whole nervous system reset that, the nervous system is pretty powerful. And so it's going to go back to what it knows until you've repatterned it consistently.
Yeah.
Right. So I'm sure there's a piece of that going on. And then there's the piece of the physiology going on. And then probably you were also doing whatever else you were doing in between those sessions to help the body. But what you said that I think is still so really interesting is this idea that the other things that you do become more impactful after the combo, right? That somehow the combo resets the terrain so that other things can land better, or the body receives them better, or responds to them better. Maybe to your point, it's a clearing of toxins and a reduction of toxic load so that things can start breathing again. So I find that fascinating. So before we kind of get too close to the end, we talked a lot about Lyme and autoimmune, but you mentioned, and on your website, you speak to depression and other mental health conditions, which we're seeing obviously are off the charts at this stage of the game. Like you can't turn around without bumping into someone who's like, oh, I've got diagnosed with ADD, ADHD, OCD is like insanely on the rise, depression, that kind of stuff. So have you had much clinical experience, or are you really focusing on the autoimmune kind of chronic illness piece?
I mean, that population is riddled with, psychiatric things like depression, anxiety, trauma, things like that. So yeah, I have seen it be incredibly effective for depression and anxiety. One of the interesting results, or preliminary results from the study as well, was dramatic and sustained decrease in the inventory of depression symptom score, which I wasn't like so anticipating. I mean, I guess it makes sense now from my clinical experience, but I was so focused on like looking at how it would affect people with Lyme and autoimmune that I did not expect such dramatic, lasting results in improvement in depression. And again, it's preliminary, so we haven't ran all of the 50 subjects. This is only based off of the first 18 subjects, but I think, from the starting average score of 25, there was an immediate drop of an average to 15. And then 3 months later, that had digressed even more to, I think, 12 or 13 for the mean score. So the fact that this dramatic drop is not only maintained, but actually continues on a small level 3 months later is pretty groundbreaking, actually. And I think those are the type of results we also see in like psilocybin research and ayahuasca research for depression. So it could be that Kambo ends up really earning its application as an antidepressant intervention.
Yeah. Well, it's interesting, right? Because it's an antidepressant intervention, not an antidepressant drug, right? So it's not the thing that you have to take every day. It's somehow it's this compound that somehow initiates or flips a switch or a bunch of switches in the body that, again, executes some kind of a reset that allows things to fall into place, and breaks these cycles, right? It seems to me that in a lot of the depression and anxiety and all these other mental health conditions, there's like this self-fulfilling loop that people get trapped in, right?
Yeah.
Like, and they are trapped. They're not They're not there because they want to be, like nobody's there because they want to be, but they get trapped in these loops. And somehow whether it's Kambo or, as you mentioned, ayahuasca or psilocybin, is it somehow breaking those loops and allowing people to kind of break free, both psychologically and from a nervous system perspective and physiologically.
Yeah, like having something that is so chemically disruptive kind of throws a wrench in the psyche's ability to have these holding patterns that result in this sustained stuckness. And definitely in psychedelic research, you hear a lot about them talking about the default mode network and how the hyperconnectivity or like excess connectivity of this brain network that is responsible for kind of locking us into like the routine and the default, right? Where we're kind of like unconscious. And so psychedelics, they disrupt that hyperconnectivity and actually add some chaos, which can be helpful if you have, too much structure. But also on the other end of things, if you have like a history of psychosis or schizophrenia, where you already have maybe a hypoconnectivity of the default mode network. But anyways, I suspect that Kambo might be doing something similar where it's disrupting these really rigid circuits in our neurology, along with a bunch of other different mechanisms. For example, there's a peptide called deltorphin in Kambo, and it's an opioid peptide. And there is some rat research suggesting that administration of deltorphin through the vagal nerve effects has gastrointestinal protective effects against ethanol-induced toxicity. And the reason they know this is mediated through the vagal nerve is that when they cut the vagal nerve of the rats, the gastroprotective effects were not observed. So that's fascinating that like there is changes in how the gut is responding to a toxin mediated by the nervous system and the vagal nerve's connection. So there's definitely some gut brain axis stuff going on. And of course there's opioid receptors, not only in the nervous system, but other tissues as well, along with all these other neurotransmitters that we think of as brain neurotransmitters, but they're all over and they're embedded and innervated in the gut very intimately.
100%. So you mentioned the word opioid. So that begs the question, people with chronic pain, have you seen that it can be beneficial for them?
Yeah. So definitely clinically, I've seen sustained remission from chronic pain. Now, I think eventually it does come back. So I don't know what frequency would be needed for that. We'd need more actual research, but it is also something that we're looking at in the study because we administer a pain questionnaire to see if people are having reduction in pain symptomology for prolonged amounts of time. But definitely there's at the least acute relief from pain. And what's cool is that these opioid peptides, they bind very potently to delta and mu opioid receptors, and they don't seem to produce withdrawals or dependency like other more conventional opioids might. And interestingly enough, in the 90s, I believe, they did one human study with one of these opioid peptides called dermorphin, and they found that it outperformed morphine for post-operative pain management in humans. Wow. And then there was like no other studies after that, which I have a suspicion why. You don't want to step on the toes of opiate companies. So might have had something to do with that, but it was definitely odd that it performed so well in the study and then there was just nothing about it ever again.
That is nuts. Well, I mean, maybe, who knows, maybe in the current climate where opioids are finally being held up as the disaster, the human disaster machine that they've become, that interest could get reignited. Wow. And I guess for chronic pain, I mean, I just read a paper somewhere recently where it was yet another researcher speaking to chronic pain really residing in the brain.
right? It's really, it starts here. Like the chronic pain could be in the hand, in the back, in the leg. And yet, and he was actually speaking as well to neuro-emotional, psycho-emotional kind of links, but that pain really is initiated in the brain and it's being felt somewhere else. And I guess it must be hitting the motor neurons or sensory neurons or whatever the case may be. And they get wrapped up in the whole thing. So with the Kambo, it makes a little bit of sense that maybe it's those it's that brain thing or the nervous system reset that is really getting shocked and knocked out of its loop kind of thing.
Yes.
Highly technical terms from Nat Nidham. Here we are, just making it real. Okay, so all right, well, let's talk about you're moving to Indonesia, to Bali, which is super exciting. I can only imagine. I've never been to Bali. It's on my wish list. But you've also started you have in place a practitioner training program. So do you want to talk about that a little bit? Because I do think, like, how do people find a practitioner they can trust? Like, where do people look? Do they listen to a podcast, or is there some kind of, like, what are the questions people should be asking of their practitioners so that they don't just, sign up with someone who may or may not know what they're doing?
Yeah. So, I mean, the popularity of Kambo has exploded. And with that, there's also been an explosion of self-proclaimed practitioners and also self-proclaimed instructors. I'm seeing a lot of 3-day long, weekends, bang it out, practitioner training, which is mind-boggling to me. I can't imagine what you could learn in 3 days that would make you qualified to hold the responsibility of someone's life. But it is important to screen your practitioners and to investigate, where their training has been done and how thorough it is. And so there's a few simple questions that you can ask. You can ask them, where did they have their training? Where or what type of safety practices and protocols do they have in place? Specifically, ask them, do you administer a test point or a safety point? Do you have water drinking protocols to protect against something called hyponatremia, which is the biggest harm that happens to people? What is their protocol with escorting people to the bathroom? If your practitioner does not do a medical screening, run far away. That should be mandatory. They should do a medical history check with you. They should ask you questions. And if they don't, then that's a huge red flag that they're taking all sorts of shortcuts and really not taking their practice seriously. You can use, I made a website directory called kambofinder.com. And so you can find a practitioner in your region, and you can also see reviews that people have left with that practitioner, which can help you kind of vet if you want to work with that provider. The site is still fairly new, so I'm hoping it'll, catch a little more momentum and be useful soon. But it is there as a resource for now. And yeah, really, I never imagined myself starting a practitioner training. I started about 2 years ago with offering advanced specialty training to existing practitioners. That was for giving them the skills to work, especially with people with Lyme disease and autoimmune conditions. And then I more recently, in the last 8 months or so, stepped into offering full comprehensive basic practitioner training courses. And I really did it out of a desire for harm reduction. I was just appalled at the amount of practitioners that were being cranked out by these subpar trainings that I felt were insufficient. And I've been getting a lot of people that come out of these trainings that are then coming to me for questions and filling in the gaps because they didn't really learn everything that they needed to learn to be safe and competent as a provider. So then I was like, I just need to make this as an available option just to protect others and to protect the name of Kambo. So I really am trying to fight all the misinformation and recklessness that I'm seeing emerge with the accessibility of information and education. So I produce a lot of educational content for free that I just want it in people's hands. I want them to know how to stay safe, even if they're buying a stick off the internet and self-applying, which I don't recommend, but I know people are going to do it anyways. So I really think we just need to share information to keep people safe and healthy if they're going to be experimenting inevitably with these things. So if anybody is interested in becoming a practitioner provider and wants to do it the real way, where you really understand all the facets, the safety, the science, and the spirituality, because all those things are critically important to being a well-rounded practitioner. So I have a training coming up, and we'll probably continue to offer them a couple times a year at least, assuming that they continue to be successful. So if anyone wants to reach out to me, feel free. It'd be my honor to be your guide and support you on your journey.
I love it. Thank you. So where can people find you? And I do have another question. So before where people can find you, are there people who should not do Kambo as a rule?
Yeah.
Like, are there people who really need to stay away from it?
Likely. So here's the thing about contraindications. We don't really know what is truly contraindicated at this point. Kambo has been introduced to the West so recently, and we are all in an experiment. So for me to say with any sort of certainty that something is or isn't safe is not really fair or valid, because there's no science to confirm this. However, there are some cautionary conditions that are wise to really ask yourself if the potential risk is worth the potential benefit. So some of my hard contraindications are if someone is pregnant, we don't want to mess with that.
No.
If somebody has had a heart attack or has like severe heart disease, again, I just don't know if it would be worth the risk, because there are substantial cardiovascular stresses on the increased heart rate and vasodilation and things like that. If someone's had an aneurysm or a stroke or an embolism, it might not be wise for them. I have made exceptions with some people who, for example, had a stroke due to the stress of childbirth, but that is more like, okay, that makes sense why you had a stroke, versus is this person predisposed with weak vasculature that could make them prone to having another one, and various things like that. And then you should have caution with a lot of other conditions, especially these chronic conditions. They do require specialty knowledge and caution from the practitioner. So if somebody has Lyme disease or Epstein-Barr or Crohn's or lupus or any of these like chronic autoimmune related conditions, they really need to work with someone experienced. And like you said, if someone's got like gallstones, I don't think they would necessarily be contraindicated, but we just don't know what could happen. So we do need to just really think critically in these uncharted waters and assume all risk. Like even though Kambo is remarkably safe, even in people with very fragile health, we still don't know really that much about it. And it's important to acknowledge and understand that you are taking a risk and experimenting with your body if you have some sort of medical complication. And also sometimes things can happen to people who had no contraindication and no way of screening out anything or no pre-existing issue that could have been identified as a risk factor. So like anything, it's not risk-free. And luckily, it seems like the risks of harms associated with Kambo are predominantly avoidable by very simple safety protocols, such as administering test point, monitoring water intake and protecting against electrolyte disturbances, protecting against faints, accidents relating to fainting and things like that. So those are really the main ways to make sure that everybody stays safe.
Love it. Okay. Well, now let's tell people where they can find you and learn more. I think you have a great website. It's got a cute green frog, a couple green frogs on there.
Thank you.
Yeah, but let's point people in the direction of the resources.
Yeah, so if anyone is interested in seeking out educational resources to become a practitioner, or if they already are a practitioner, my site kambospecialist.com is the best resource. I also have my own private practice website, which is medicinefrogkambo.com. And I have some informational articles on there about the science of Kambo, how to choose the right practitioner for you, everything that you need to know about Kambo. So there's a lot of, frequently asked questions and things like that, resources for people to learn more. And then if you are looking for the right provider for you that's in your region, you can try on kambofinder.com. Hopefully you'll have luck. Like I said, it's a newer venture, so it's still in the early adoption phase. So the more people that use it, the more practitioners will get listed, and the easier it will be for people to find the right provider for them.
Okay, that's amazing. Well, thank you so much. This has been great. I think that, to your point, there's still so much we need to learn about Kambo, but there's people like you who are actually doing research, which I imagine you're going to publish your research results on your websites when they're ready for sharing in the next couple of years. And that's just going to start building that body of knowledge that's going to help to, ultimately help more people.
I sure hope so. Yeah, there's a couple of studies I've already published that are on medicinefrogkambo.com.
Great.
So if anyone wants to read those, there's some information already out there.
Okay. Well, Caitlin, thank you so much for your time today. This has been amazing. Thank you.
Yeah, thank you. It was a pleasure. Appreciate it.